Phase 1B of the state's COVID-19 vaccine distribution plan is underway, and starting next week, those 75 and older will have access to the vaccine. We know that many of you have questions about the COVID-19 vaccine, so we have Dr. Joseph Gastaldo from OhioHealth joining us live this morning to help answer some of your questions. Dr. Gastaldo, thank you so much for joining us.
Good morning, Karina. I'm very happy to be here.
Well, first, let's talk about something new. You were part of a WebEx yesterday talking about new information about the vaccine. So what's the very latest when it comes to the vaccine that you think it's important for all of our viewers to know?
Yeah, so as everybody knows, there's a lot of changing information related to COVID-19. Stuff changes as we learn more, and that's also true with the vaccination. And, the CDC did do some minor tweaking to the recommendations. So we all know that Pfizer is dosed every 21 days, Moderna every 28 days. And as best as possible, we should continue to stick to those recommendations. But obviously, to quote another famous infectious disease doctor, we don't want to have perfection be the enemy of the common good. So what the CDC tweakness that they did yesterday was that if needed, the second dose can be delayed up to 6 weeks or 42 days. And as best as possible, if you start with Pfizer or Moderna, you should stick with Pfizer or Moderna. But if there is a situation where somebody has to get the other vaccine, or as we all know, human error can happen, that the dose does not need to be replaced. So minor tweaks like that, and I expect more tweaks or recommendations to come out as we learn more.
Okay, so I asked on my Facebook page, and a lot of people want to know, does the vaccine work on the different strains of COVID-19 that we're now seeing in the United States? And can you update us on those strains?
Yeah, so as everybody knows, we are identifying more strains, and it's very important that we continue to do that through genetic sequencing, where various labs sample the viruses that are circulating to see how different they are. These are RNA viruses. This specific RNA virus, SARS coronavirus 2, has been changing over the last year, and it will continue to change. You hear all these news stories about changes in the spike protein. And when you get an immune response from a vaccine, you really get a very complicated immune response with the induction of many different types of antibodies. And the worst case scenario is that there is such a significant mutation in the spike protein that we induce a situation called immune escape, where the vaccine does not induce any type of immunity. And again, that doesn't happen in a on-off switch. That happens over a gradual process. And there are more information coming out that tentatively, it appears that both Pfizer and the Moderna vaccines are expected to induce an immune response to the variants that are out there. Now, it could be that the immune efficacy is less than 95%, which is what these two vaccines are. It could be that it's 80%, but still, that is a great immune response. And if we remember back in the time, the FDA initially was going to approve anything with greater than a 50% efficacy. And the flu vaccine actually performs roughly in the 60 to 70% efficacy, and that's considered a good vaccine.
Okay, so what I'm hearing is that for the most part, the vaccine should work pretty well on those variants.
Absolutely. Again, that we need to continue to follow that. We need to allow the bench scientists to do their thing when it comes to genetic sequencing. And guess what? Worst case scenario, this virus will have immune escape, which is not going to happen until a while. And we could tweak the vaccines. They could be changed, and that's always going to happen in the background.
Okay, I've had some questions on Facebook as well. People wondering, if I have health issues, should I be getting the vaccine? Is it going to impact me differently? So who should be wary about the vaccine? What kinds of health issues?
Yeah, so really, the vaccine can really be given to anybody with, of course, some caveats, and I'll put some caveats out there. Obviously, people with weakened immune systems. Historically, we've given vaccines to people with weakened immune systems for many years. Influenza, pneumococcal vaccinations. The thing with the weakened immune systems, it's those vaccines that are live vaccines. Live vaccines, live viruses can cause essentially a mini infection infection in people with weakened immune systems. The messenger RNA vaccines do not cause COVID-19. So people with weakened immune systems can still develop a good immune response to the vaccines. Now, granted, people with weakened immune systems may not have the same robust immune response compared to somebody who has a normal immune system, but some immunity is better than none. People with autoimmune diseases, it is the recommendation that they can receive the vaccine too. Pregnant women, the recommendation basically is that, yes, they can receive the vaccine, knowing that pregnant women were not put part of the studies. However, that really is an individual decision between a pregnant woman and their healthcare provider to really understand the risk versus benefits of receiving the vaccine.
Okay, so let's talk about the rollout of the vaccine. This morning I've been reporting on, not enough vaccines available to go around in places like New York City, LA. It's a slow process, slower than what we wanted, but people are anxious to get that vaccine. So where is the best place for people to go to make an appointment? Because I'm looking at the OhioHealth website and it says that scheduling will reopen January 28th. All appointments for patients 75 and older have been filled, but is there a one-stop shop for people to make that appointment?
Yeah, that's what's challenging, Karina. Again, we want people to get vaccinated, and the big elephant in the room is really twofold. One is vaccine supply, and then obviously the infrastructure in place to vaccinate people. And again, I don't have a lot of detailed answers for that. I think, ODH, Ohio Department of Health, has a website where anybody could go to with their county, and those vaccine administrators are listed on there. But then it's up to them to actually call there and figure out how to make an appointment. And each place is doing it differently. At OhioHealth, for example, we do have vaccines. We are vaccinating people, but we are limited by the number of vaccines that are allocated to us by the Ohio Department of Health, which gets them from the federal level. So it's very complicated. As time goes on, I feel confident in saying that more vaccines will become available. We likely have the Johnson & Johnson vaccine, hopefully here sooner than later. But again, everything related to COVID is a little bit clunky at first, but guess what? As time goes on, looking forward, I'm certain that a lot of the bugs and kinks will be worked out where people will have access to getting vaccinations.
So let's talk about looking forward. So far, 5% of Ohio's population has at least received the first dose. We've heard different timelines, but when do you think the majority of us will be vaccinated in Ohio and across the U.S.?
Yeah, so based on the supply chain of the vaccines and what's coming out of people like Dr. Fauci, the CDC, and the federal government is, tentatively, it appears that there will be likely widespread access to the vaccine by spring, late spring, early summer. So really, we're not that far away. And granted, I know everybody has COVID fatigue. I know I do, but we really need to stay all on point with what we're doing with the mitigation strategies until we really get enough people vaccinated before we can have any discussion about de-escalating any of those mitigation strategies.
And I have about 20 seconds left. I want to ask you this. If your grandparent or someone who's older has already received both doses, should you feel safe being around them now?
You can feel safer being around them. When it comes to how the vaccines perform for asymptomatic infection, we just don't know. We know they're very good at preventing severe infection, keeping you out of the hospital. And more than likely, they will have an impact on decreasing asymptomatic infection, but we don't know yet.
Okay, so you still want to be careful. Dr. Gastaldo, thank you so much for spending so much time with us this morning, answering so many questions. We really appreciate the work that you're doing.
Thank you.
And if you at home have any more questions about the COVID-19 vaccine, you can text them to the number on your screen, 614-460-3345. We will try to keep those questions answered throughout this whole pandemic for you and keep you informed. We will be right back.